At last EBCC, we heard from the study of Dr. Laus and colleagues that assessed the impact of pain neuroscience education, one session, plus 5 sessions of behavioral graded activity on pain among survivors of early stage breast cancer. So the study tested whether the intervention could reduce immediate post-intervention pain as well as longer-term pain at 3 months post-intervention. So what the authors found was that many pain-related outcomes in this study were in fact improved by the intervention. This was in the immediate post-intervention period as well as in the 3-month post-intervention. And in additional research and additional findings will elucidate whether there's a longer-term impact at 12 months post-intervention. I think what is most important to highlight about this study is that this beautifully complements the data that we have about non-pharmacological interventions for pain among survivors of breast cancer and more in general pain among survivors of other types of cancers, since this is such a relevant and impactful symptom. So what we do know is that behavioral interventions can work, are sustainable, are safe, and especially if these interventions are tailored on the patient population we're treating, that they can exert the maximum impact. So what I mean by tailored, I think we really have to underline specific aspects of this study that make it successful compared to previous research in the field. For example, the population was selected upon the presence of baseline pain higher than a threshold that was 3 out of 10 on a validated scale. Therefore, this made a difference compared to previous trials that did not select the patient population, and therefore they were not able to demonstrate any impact of the intervention. In addition, the intervention itself and its goals were co-constructed. This was an exercise of co-creation with the patient themselves. So for the behavioral graded activity component of the intervention, patients could choose what kind of activities they wanted to perform. So either a physical activity like exercise or an activity of daily living that could be relevant and time-bound for them. So this was very important to help patients reach the goal within the pre-specified time frame. And I think this type of research also makes us reflect on how we can continuously improve the behavioral interventions. Particularly, the same group of authors are going to study whether targeting specific patterns of pain, for example, maladaptive thoughts or perceived injustice patterns, can actually modulate pain, and whether using some behavioral techniques such as motivational interviewing could enhance the intervention impact in the future.